My son is Michael Shaw. He's 16 years old. He has Duchenne muscular dystrophy, and last August he had a major operation for scoliosis of the spine at Alderhay, and we didn't get out until we were fully trained on a Synchrony 2 respirator, which Michael has to use overnight. There are parts of the Synchrony 2 that have to be changed: the filters, the nasal pads. We were promised at a meeting at Alderhay when the Synchrony was ordered that everything would be in place for ordering these parts and there wouldn't be any issues. We were guaranteed that. On the 7th of January we put the first order in. I had no idea how long the order took to arrive. I contacted Alderhay and they said it would be between a week and 10 days. 2 weeks after I ordered them, I chased it up again with the person I'd ordered them with. She reordered them, chased them with Wesham, heard nothing, and by the middle of February we were quite frantic because nothing had turned up. Because the seal was going, we were concerned if he caught another infection he was going to die, or he's going to end up in ICU. I did ask her what she was doing about it, because she was my only point of contact, and unfortunately she said, well, her only part in it was to pass my request through to Wesham. She was just copying down what I was ordering. I knew the parts, the quantities required, and she just copied them on a acquisition sheet. My wife wrote a letter to the chief executive. It was a complaint letter, but it was an ongoing complaint, an urgent complaint. We were hoping that letter would cause people to understand the seriousness of the situation and we'd get the parts. When we received a phone call back saying the trust has 25 working days to respond to that letter, when the letter wasn't a historical complaint but an ongoing desperate complaint to stop Michael ending up back in ICU or worse, that's the time I contacted Pauline Wilson and our MP. If the letter to the chief executive had been taken seriously and not just dismissed as another complaint, this would have been sorted in-house with a lot less fuss. I rang Alderhay to get urgent supplies sent because I was getting nowhere at Blackpool. After that, Nick Pym became involved via Pauline Wilson, and credit to him, he made sure that the supplies were delivered. The problem being, in my opinion, is there was another order put in and these supplies turned up within a week. He delivered the first set himself. It was ordered on the Monday. He turned up with some face masks on the Friday. That's the first time I'd met him. He had told me that there had been a mess up at Wesham and the lady doing the orders had dropped sick and nobody was doing her job for whatever reason, which I find abysmal. That means if one person drops, nothing was going to get ordered. That was a ridiculous situation. I don't know whether he's fixed it. In effect, the parts I requested were doubled up, trebled up on the requisition sheet that had been sent to Wesham. I received things in the post weeks later, and with a query from ResMed, who supplies some of the parts, saying, why have 75 masks been ordered? I'd only ordered one. I did point out that it wasn't working, me just copying an order to the community nurse. It just didn't seem to work. Wesham didn't want to speak to me. Before I knew it, about a month, 6 weeks ago, the sister at the GP surgery, where I'd initially said, wouldn't it be better to go to our GP surgery, it's not going to be posted direct to me, said, oh, I've taken over ordering your parts. I've put I've ordered parts via her. She's took no nonsense from Wesham, whose argument is, oh, there's a cost implication in ordering these things. And she's took no truck from and said, just do as you're told. The patient needs these, ordered, get them ordered. And I've received the orders within a week.